Normally, the cancer cells, they evade the immune system. The cancer cell also wears a mask, like as though it is a normal civilian, and then it passes through the security gate of the immune system. So therefore, the immune system is unable to identify it. There are certain markers like called programmed death ligand 1 on the tumor, and then there is other CD markers on the tumor cells which are present, which actually are like an antenna, for which the body can identify it. But these are masked. What does immunotherapy do? Immunotherapy unmasks these particular receptors, because of which the immune cells can identify these cancer cells as foreign or as an imposter, and kalla avano, idiyo avanna, size avanna. It does that, catches hold of that cancer cell and kills it. So therefore, immunotherapy helps the body's own immune system to identify a cancer cell and kill it. So it's basically use your own mechanisms, your own weaponry. You don't need to take any external weapons. We use our own India's Tejas aircraft, BrahMos missile to fight wars. You don't need to have any other international or any other foreign weaponry, something like that. Normally, the cancer cells, they evade the immune system. Some patients will come and ask me, sir, immunotherapy kodi sir. I'll be like, okay, for what? Earlier, around 5-6 years back, there were only 3 or 4 cancers, especially some like a skin cancer like called melanoma, malignant melanoma, and then afterwards lung cancers, and then recently breast cancers, which were used, or for which immunotherapies were used. But then afterwards now, there are almost 18 to 20 indications for most immunotherapies. If you take from breast, if you take for different types of lung cancer, small cell lung cancer, non-small cell lung cancer, if you take for nasopharyngeal cancer, head and neck cancer, uterine cancer, some prostate cancers, GI tract cancers, stomach cancers, esophageal cancers, you name it, and most of those tumors are now approved to be given immunotherapies. So it is not that these cancers became more immunoreactive. It is just that with time we have realized that in certain subsets, if you are able to pick out your patient, we know that the immunotherapies would work wonderfully on them and give the patient a good quality life and a long life as well. Autoimmune side effects of immunotherapy. I'm sure you all think that immunotherapy is some glitz glamour. It is a drug which is mixed into normal saline and given over half an hour to 1 hour. It does not have the side effects of chemotherapy like hair loss or vomiting or fatigue. It is just like a booster injection where you take it inside and then afterwards you don't feel any difference at all. You carry on with your regular work. But there are certain pitfalls. It's not as easy as we think it is. So this basically, it activates the immune system to identify and kill cancer cells. I have told in my previous videos, right? Now think about the situation where you empower the police or the security system so strong that apart from identifying and killing the criminals, they also start affecting the normal cells. This is called autoimmune. Self, that is destruction of self itself, self cells, that is good cells it starts killing. This doesn't occur for every other patient, but it's seen around 5 to 7% of patients. It can present with loose motions, it can present with some breathing problem. So itis means inflammation. It can cause an inflammation of any organ, right, from skin to eye to brain to nerves to lung to gut. Any of these can get affected, and even bone marrow. We have 2-3 patients who have even bone marrow. Doesn't mean that you get frightened of it. If you go to a doctor who's well trained in administering immunotherapy, you will realize that they will take proper history every time before they infuse the drug. With this, they will be able to identify who are the people who are prone to develop complications, then nip it in the bud. So the point is, like in a car, Ferrari car, it's not about just going at 300 kilometers per hour. You should know when to brake and you should know how to brake. That's what a good oncologist would do for you. Once I use the term immunotherapy, many of our patients, they get startled saying that immunotherapy na tumba costly agutta sir, very expensive. So basically, when it came out in 2016, that time the cost of the drug was somewhere close to around 2.5 lakh for a 100 milligram vial. Now that that vial is now cost around 1 lakh. That too comes with a 1+1 patient assistance program. Every company has seen that you can't market the drugs at the same rate where it is being made available, like in the US or in Europe. The drug is curtailed and changed to match the GDP of our country. So therefore, because our GDP is lesser than that of the European and the so-called westernized nations, we enjoy, or to a certain extent, that the drug costs have been reduced to a very large extent. But even then, that is very expensive for our Indian brothers and sisters. So what has the government done? Like in the recent past, you might have heard, or so many other drugs like daratumumab, and then afterwards durvalumab. The government has cut down the GST on the exports. No, but why are these drugs expensive in the first place? There's so much of research. R&D has gone inside to ensure that the drug is safe for use. So it has been gone through so many clinical trials, and each clinical trial, each amount of research, drug discovery, everything costs money. So the money that has been spent for all of that is being put onto this particular drug. So with time, when we get generics, the drugs costs are going to reduce by more than half. It's going to become probably a fraction of the cost it is as of today. It is just a matter of time when the drugs lose the patent, and then Indian market will be flooded. It might probably cost only 1/10 of the cost. We're looking forward to that day. Some patients will ask me, sir, chemotherapy innu better or immunotherapy innu better? So, difficult question to answer, because we say that, you know what, chemotherapy is good, immunotherapy is also good. When you combine both of them, result is even more splendid. So they're like, sir, you want to give both, double side effect, sir? I'll be like, only costs will go up. Apart from the side effect profile is not much, because they both come with different set of side effects. Both of them, we know how to handle them very well these days. So therefore, there is not much problem. So which is more, comes the question that which is more effective. So for this, it is like identifying like a jataka or the horoscope of the tumor. There are certain markers like microsatellite instability or MSI, markers like tumor mutation burden or TMB, then markers like PDL1 or programmed death ligand 1. So you look at these markers. These are the horoscope entities that you look into the tumor cell. If these come positive and there is a certain percentage of it which is seen, if it is beyond a certain number, you know that the immunotherapies are going to work very well. For example, in lung cancer, if the PDL1% is more than 50%, that means to say that only immunotherapy is sufficient. You don't need chemotherapy at all for the patient. Immunotherapy, the patients will do better than if you give them chemotherapy. But if it is less than 50%, these patients, giving chemotherapy is going to be useful, and adding immunotherapy to the chemotherapy, patient is going to do very well. So you see, there is no like this is better than that. Both of them, it is like hero and heroine. It is not whether the hero is the main thing of the movie or the heroine is the main character of the movie. Both of them, when they do a duet dance, the movie becomes a hit. Here, the chemo and the immunotherapy, both when given together, patient benefits. Thank you.